Are your legs getting weaker with age? What if the real problem isn't aging, but what your body's missing before bed? Stick with me, because tonight we fix that. Hi, I'm Dr. James, and I've helped thousands of seniors regain mobility over the past 2 decades. Tonight, I want to introduce you to 3 essential vitamins that your body craves after 60, but that most seniors never take at the right time. If you've been dealing with leg cramps, numbness, or instability, this could be the most important information you hear all year. Let's begin with the most overlooked vitamin of all, B12. Why B12 matters. Vitamin B12 isn't just for energy. It's essential for keeping the communication between your brain and muscles sharp and responsive. Without enough B12, messages from your brain to your legs get delayed, misfired, or lost entirely. This results in leg weakness, balance issues, numbness in your feet, and even dangerous falls. Research published in Neurology tracked over 25,000 older adults. Those with low B12 levels were nearly 3 times more likely to fall and suffer leg dysfunction than those with normal levels. And here's the catch. After age 60, your stomach produces far less acid. That acid is what's needed to extract B12 from foods like meat, eggs, or fish. So even if you're eating well, you might still be B12 deficient without realizing it. Signs of B12 deficiency: tingling in your feet, stiff calves in the morning, sudden leg fatigue after standing, feeling off balance, knees buckling unexpectedly. These symptoms can mimic neuropathy or even early Parkinson's, but often they're just a sign of low B12. If you're over 60, forget standard multivitamins. Your body needs methylcobalamin, the active form of B12, and not in a tablet you swallow. Use sublingual drops or dissolvable lozenges. Place it under your tongue. Let it dissolve slowly. No digestion needed. Dosage: 1,000 micrograms per night, 30 minutes before bed. Set a reminder. Keep it next to your toothbrush. Make it a ritual. Why nighttime is key. Your body heals when you sleep. Nerves regenerate. Muscles reset. That's why B12 at night is smarter. It fuels that repair process. Taking B12 in the morning? Fine. But taking it before bed? Transformational. Plus, B12 won't keep you awake. In fact, many report better, deeper sleep after a week or 2 of nighttime use. A patient of mine, 74 years old, came in because she'd fallen twice in a month. We tested her B12, barely above the deficiency line. We started her on sublingual B12 at night. 3 weeks later, she came back more stable, no falls, and for the first time in months, she was walking without fear. This wasn't a miracle. It was just science. If you're taking other medications, metformin for diabetes, it depletes B12. Acid reducers like omeprazole or lansoprazole, they block B12 absorption. Vegan or vegetarian, your diet might lack natural B12 entirely. These aren't problems, they're signals, and they're fixable. How long until it works? Some notice better leg control in 10 to 14 days. For others, it's 4 to 6 weeks. But most seniors I treat report fewer cramps, better sleep, and steadier steps within the first month. Consistency matters more than dosage. Don't skip. If your legs feel weak, if your feet go numb, if your calves cramp up at night, don't assume it's just age. Try B12. Take it consistently. Give your body the support it needs while it's actually trying to repair. You don't need another medication. You might just need a missing nutrient. We'll look at a second vitamin that directly supports muscle strength and reduces inflammation overnight. Most seniors skip it, and it's costing them years of mobility. Most seniors know vitamin D3 as the sunshine vitamin that helps keep bones strong. But what you may not know is that D3 is also a direct player in muscle strength, inflammation control, and nighttime recovery. Once you cross the 60-year mark, your skin loses its ability to make enough D3 from sunlight. In fact, even with 30 minutes of daily sun exposure, you might still be deficient. Studies show that over 70% of adults over 65 have inadequate D3 levels. That's not a small oversight. It's a widespread weakness in our aging healthcare system. Signs of D3 deficiency: slower walking pace, feeling tired after minor activity, achy thighs or calves at night, getting sore even without exercise, unsteady on stairs or when standing from a chair. D3 is one of the first nutrients I test for when a senior tells me, "Doc, I just feel weaker lately." D3 supports a process called muscle protein synthesis. This is how your body repairs and rebuilds muscle fibers after daily movement. Without enough D3, that repair slows. Muscles shrink, weakness creeps in, balance suffers. In a 2020 study published in the Journal of Clinical Endocrinology and Metabolism, seniors who took D3 supplements before bed experienced a 34% reduction in falls and 19% increase in leg strength over just 3 months. That's not a minor improvement. That's life-changing. Your body releases growth hormone during deep sleep. This hormone activates your muscle repair systems. But without D3 present in your bloodstream, the process stalls. Taking D3 before bed primes your body to absorb calcium properly, support collagen repair, and reduce chronic muscle inflammation. That tight, burning feeling in your calves at night, it's often linked to low D3 and microinflammation in the muscle fibers. By supplying D3 right before bed, you're handing your body the missing ingredient to repair and rebuild. How to take D3 properly. Choose vitamin D3, cholecalciferol, not D2. Most adults benefit from 2,000 to 4,000 IU per day. Start at 2,000 IU and retest levels after 8 weeks. Take it 30 minutes before bed. With food? Yes, since D3 is fat-soluble, pair it with a small fat source. A spoonful of almond butter, a few walnuts, or a slice of avocado will do. Form preference. Soft gels or capsules are more reliable than gummies for seniors. Mr. T, a 67-year-old client of mine, had been taking D3 in the morning for years. Still, his legs ached. He couldn't walk more than 10 minutes without stiffness. We didn't change the dose. We just changed the timing. Moved it to bedtime with a spoonful of Greek yogurt. 1 month later, his pace improved. Less nighttime pain. And the stairs at his church? No longer intimidating. A common mistake. Many seniors take D3 inconsistently or too early in the day. But D3 works in harmony with your natural recovery cycles. That means evening is when it matters most. Also, D3 and calcium aren't meant to be taken together in high doses at night. It can disturb sleep or create GI upset. Keep calcium earlier in the day. D3 may improve the quality of your sleep. A study published in Nutrients, 2022, showed that seniors with optimal D3 levels had fewer leg cramps at night and deeper, more restorative sleep. Why? Because D3 helps regulate serotonin, which in turn influences melatonin. So if you're tossing and turning while your legs twitch or ache, low D3 could be the hidden culprit. Remember the B12 we talked about in part 1? It works even better alongside D3. Together, they address the 2 biggest recovery processes: nerve communication, B12, and muscle regeneration, D3. Stack them together 30 minutes before bed with a light snack and let your body do the rest. If you're over 60 and you feel like your body is slowing down, your legs sore, stairs harder, movement stiffer, it's not inevitable. It's reversible. You don't need a gym membership. You need nutrients, timed wisely, used consistently. Let these small actions restore what time has taken. Because you're not done moving. You're not done living fully. Vitamin K2 is not the same as K1. K1 helps blood clot. K2, on the other hand, directs calcium to your bones and away from places it doesn't belong, like your arteries, joints, and soft tissues. Without K2, your bones don't get stronger. Your muscles don't recover. Your legs stay stiff and sore. It's like having bricks, but no blueprint. Yet almost no seniors are taking K2. Calcium is essential, but without a guide, it ends up in your blood vessels and joints, not your bones. That can cause stiffness in the knees, tightness in your calves, and even numbness in your feet. You may be experiencing all this and wondering, why? I'm taking my D3, I'm eating right. The answer could be simple. You're missing K2. Vitamin K2 activates a protein called osteocalcin, which helps deposit calcium into bones. It also triggers matrix GLA protein, which prevents calcium from hardening arteries and soft tissues. Think of K2 as the body's calcium GPS system. Without it, things get lost, and that means your bones stay weak and your joints suffer. A study published in Nutrients 2021 showed that seniors who supplemented with K2 improved quadriceps strength by 21% and standing balance by 31% in just 8 weeks. That's not just a supplement, that's activation. A 68-year-old patient of mine, former tennis player, started getting knee pain and tight calves. He was taking calcium and vitamin D daily. Labs were fine, but his body wasn't absorbing calcium properly. We added -7 Malawian kwaches, the most bioavailable form of vitamin K2, to his evening routine. 8 weeks later, less stiffness, better stair climbing, and stronger legs. Just like D3 and B12, K2 works best before bed. Why? Because your bones and muscles regenerate at night. Taking K2 in the morning is better than nothing. But taking it at night means it works with your D3 and during your body's natural repair cycle. That's synergy. That's smart recovery. What to look for on the label. Form. Look for -7 Malawian kwaches, not -4 Malawian kwaches. -7 Malawian kwaches stays in your bloodstream longer. Dosage, 100 to 200 micrograms per night, is ideal for most seniors. Timing, 30 minutes before bed, taken with D3. With or without food. It's fat-soluble, so pair with a small fat source. A few almonds, avocado, or a teaspoon of olive oil. Avoid pairing it with calcium-rich food or supplements at night unless instructed by your doctor. D3 helps absorb calcium into the bloodstream. K2 ensures it gets out of the bloodstream and into the bones. If you're taking D3 without K2, you may be moving calcium but not directing it. That's why some people on high-dose D3 still feel stiff or inflamed. D3 and K2 are partners, like brakes and a steering wheel. One without the other, you're not going far. Signs you may need K2. Aching knees despite taking D3. Cramping calves at night. Feeling like your legs tighten throughout the day. Bone scans showing no improvement despite calcium intake. You're over 60 and not eating fermented foods like natto, aged cheese, or organ meats. K2 isn't common in the modern diet. And without it, your body may be storing calcium in all the wrong places. K2 helps activate osteocalcin, which improves blood sugar control and boosts insulin sensitivity. That's huge for seniors with prediabetes, metabolic syndrome, or circulation issues. Better blood sugar equals better muscle fuel equals better leg endurance. In a clinical trial published in Aging and Disease, seniors who took K2 daily showed better walking speed, less fatigue, and steadier steps, especially in the morning. Start small, stay consistent. Take K2 with D3 before bed. Track your progress weekly, not just with how you feel, but how you move. Your knees may stop cracking. Your calves may feel looser. Your legs may carry you further without the soreness. That's not magic. That's micronutrient therapy done right. And don't forget, K2 isn't just helping your bones. It's helping your heart. It's keeping calcium out of your arteries. That's long-term protection you don't want to skip. Why a nighttime routine works. Healing doesn't happen during the day. It doesn't happen while you're active, walking, or doing chores. Healing happens while you sleep. That's when your body releases growth hormone, repairs nerves, rebuilds muscle fibers, and strengthens bone tissue. If your legs have been aching, cramping, or weakening, the fix doesn't start in the gym. It starts in bed with the right routine. Let's recap what you need to take and when. Vitamin B12. Form: methylcobalamin. Dosage: 1,000 micrograms. Method: sublingual under the tongue. Timing: 30 minutes before bed on an empty stomach. Tip: place the bottle next to your toothbrush to remember. Vitamin D3. Form: cholecalciferol. Dosage: 2,000 to 4,000 IU. Method: soft gel or capsule. Timing: with K2, 30 minutes before bed. Take it with a small fat source, a spoonful of almond butter or a few nuts. Vitamin K2. Form: -7 Malawian kwaches. Dosage: 100 to 200 micrograms. Method: capsule. Timing: with D3. Note: no need for a heavy meal, just a bit of healthy fat. Take all three consistently every evening. This is your body's rebuild window. This is when strength returns. Here's what I recommend to all my senior patients. 1 hour before bed. Stop eating. Dim the lights. Turn off screens. Do a 5-minute walk around the house. 30 minutes before bed. Take your B12 under the tongue. Take D3 and K2 together with your snack. Drink a small glass of water or warm herbal tea. 10 minutes before bed. Do gentle stretches, ankle circles, leg extensions, or heel raises. Breathe deeply. Get into bed slowly and mindfully. Think of one thing you're grateful for about your body that day. This routine doesn't just feed your body. It tells your nervous system it's time to heal. Let's add 3 easy daytime habits that triple the impact of your vitamin routine. Hydrate with purpose. Sip water throughout the day. Aim for 1 glass every 90 minutes. Add a lemon slice or cucumber if needed. Stop drinking 1 hour before bed. Why it matters. Water helps transport B12 to your nerves and D3 to your muscles. Without water, these nutrients stall. Eat an anti-inflammatory dinner. 2 hours before bed. Avoid sugar, white bread, fried foods. Choose lean protein plus steamed vegetables. Why it matters. Low inflammation means higher absorption and less nighttime pain. Move your legs before bed. 5 minutes is enough. Try seated kicks, calf raises, or gentle squats. Use a chair or wall for support. Why it matters. Movement increases blood flow and helps those nutrients reach your muscle tissue faster. Most seniors notice improvements within 1 to 2 weeks. Fewer nighttime leg cramps. Deeper, uninterrupted sleep. Less tingling or burning in the feet. 3 to 4 weeks. Improved balance. Reduced stiffness in the knees. Better energy when walking. 6 to 8 weeks. Stronger muscle response. Easier stair climbing. Improved posture and endurance. But remember, it's not about overnight change. It's about compounding healing. Small actions done consistently lead to big changes. Before starting any new supplement routine, always check with your doctor, especially if you're on blood thinners like warfarin. Vitamin K2 can interfere. You have chronic kidney disease. You're already on high-dose supplements. You've had bariatric surgery or digestive disorders. These vitamins are generally safe, but personalized care always comes first. The takeaway: if you do nothing else, do this. Take your B12 onto the tongue. Take your D3 with a bit of healthy fat. Pair it with K2 and give your body time to absorb it. Add water, a light dinner, and movement. Sleep with intention, because real recovery doesn't start in the morning. It starts tonight. Comment leg strong if you're starting this routine tonight. Like, share, and subscribe if this video helped you. Tell a friend, a parent, or a neighbor. You might just change someone's life.